Hey, hope you're having a good day. So, working around any injuries that you have is going to be really important, especially if you want to make progress with, not only your strength, your flexibility, longevity, so that you are fit and strong, for the rest of your life. So you have high quality of life going into your, 50s, 60s, 70s, 80s, but also so that you can feel your best mentally, physically, emotionally. And I'm going to give you loads of examples when it comes to training and how you can work around things, right? So I'll give you examples from me and then from some people that I work with. So for me, recently I had a wrist injury, right? So I couldn't do any push-ups because putting too much weight on my hand was giving me a lot of wrist pain. So what I had to do was substitute that. So instead of doing push-ups, I had to think, okay, what other chest, shoulder, tricep, or upper body pushing exercise can I do instead? So what I substituted it with was a seated dumbbell rotational shoulder press, where you basically hold the dumbbells like this and then rotate as you go up. So you could literally, I could have done any type of shoulder press variation, but that rotational shoulder press works a lot better for me because not only was the wrist an issue, I've had a long term issue with my right shoulder also. And that's something that I've strained in the past. So that is the safest, most effective movement for me to do to keep my upper body strength and to give me something positive to keep focusing on. Some other movements that I did as well, added in a little bit of tricep work, so some banded like kickbacks with a resistance band, um, and then for some chest work as well, directly added in some banded presses. So literally tied a band around like a bar, and then was just like doing some punches with the band, but also some presses as well. So there are a few different variations that I was able to change or add in to work around it. And at the same time, I was doing some wrist rehab exercises. And thankfully now the strength is coming back up, right? So that's one example. Another example, I tore the cartilage in my right knee when I was like 14 or 15. So it's something that I've constantly like had pain with over, I'm 28 now, so the last like 13 years. So I was doing a lot of heavy squatting, like with a bar across my back before. I'd hit a max of 180 kilos. Um, and basically after a few years of doing a lot of powerlifting training, I realized like, oh, squatting with a bar is actually just making my knee more inflamed and like not helping it at all. So what I noticed I can do instead of like a heavy squat is I will do some walking lunges or a Bulgarian split squat. That's where you elevate your back leg and you basically do a split squat on one leg. So I can't really do any squatting because it just really irritates my knee. So I don't do squatting of any kind. I don't use a bar, I don't use a dumbbell. I'll do some really slow controlled body weight squats, but my main quad and glute work is with weighted lunges, walking lunges, or Bulgarian split squat. They're the two movements that I can do. So that covers chest, triceps, shoulders, also quads, glutes. When it comes to hamstrings, lower back, posterior chain in general, deadlifts are a great movement. And I used to do a lot of heavy conventional deadlifts, right? So just with a normal bar. Um, and with that, it did work well, but unfortunately, uh, I have had some issues with like my QL and with my lower back. If I go like too heavy, I can like re-injure the QL because I've strained that like probably like 4 or 5 times over the years from going really heavy. Um, and what I do now instead is I'll do a single leg deadlift. So if you don't know what a single leg deadlift is, you can look it up. It's really simple. It's literally a deadlift, except you're just doing it on one leg, and you can hold like dumbbells in your hands or plates in your hands. And I find that is one of the better movements for me now when it comes to hamstrings, quads, or hamstrings, glutes, and lower back. And I'll put in some normal deadlifts, like, or conventional deadlifts the odd time, but the single leg tends to suit me a lot better, right? Because it doesn't irritate my back or my QL as much. So it allows me to progress safely and, most importantly, feel good. Then when it comes to a few other things, I did like have this like calf issue. Is I think it was like more of a soleus, like I don't know, it was like one of the deeper calf muscles. I can't remember what it's called. The peroneus, I think it was, but it was kind of in between the calf and the Achilles. So I had an issue with that, and when it came to like skipping and stuff, I was getting quite a bit of pain. And what I found was that gradually over time, of just slowly increasing the amount of skipping I was doing, because before I'd do like a minute of skipping and that would cause a lot of pain. And I found that as I gradually worked the skipping up and kept that in my training, about 2 or 3 times per week, over the course of about 5 or 6 months, I got to the point where I actually have no pain there at all now. And, I can skip for like, if I manage my pace, I can skip for like 8 to 10 minutes straight. And I can do, 15, 20 hops on one foot and get no pain. And so that was a gradual progression of just slowly increasing the skipping for that pain to go. Some other examples would be, I get really bad like elbow tendinitis and have done for years, even when like going back to when I used to play golf back in like 2009 to 2012. Even playing golf, I was getting elbow tendinitis back then. So I found when I was doing powerlifting training, like anytime I use barbells, basically, I'll get really bad elbow tendinitis. So I don't do any barbell work at all. I'll only use like kettlebells or dumbbells or stuff like that, or a lot of like body weight exercises. So now my elbow tendons, they don't really get too irritated. And in the meantime, I've done rehab work of strengthening up, the flexors and stuff for my forearms, flexors, extensors and stuff. So it's not as bad as it was before. So that's how I'm working around the elbow tendinitis. As I mentioned earlier, my right shoulder has been giving me issues for years. I think it even goes back before training, before I started going to the gym in 2012. So I can't actually, I notice anytime I do like pull-ups, it'll irritate my shoulder. So what I can do though is chin-ups. So you'll never see me doing any pull-ups now, because if I do more than a set of 5, it really irritates the rotator cuff on that side. So what I do now is I do chin-ups, and I can do, I can safely work up on chin-ups without it irritating my shoulder. And, thankfully I've been able to work up from body weight to weighted ones and up to like plus, I hit a personal best of plus 45 kg on weighted, like full chin up, like all the way up, all the way down from a full hang, not any half reps or anything like that. So a chin up is how I'm working around the rotator cuff issue, because that position with my hand, it feels pretty good. So that's just a few different examples of how you can change your exercise selection to really allow you to progress and, most importantly, not get injured. Or if you do have any past injuries, you can work around them by just making a smarter choice with the exercise that you're doing, whether you're training in the gym or whether you're training at home. It doesn't really matter. But that's just a few examples, from me personally. And, when I'm working with people, anyone who signs up to my 8-week transformation program, the first thing that we do is like a screening session for 30 minutes. And I'll walk you through like loads of different exercises, and we'll figure out what works for you, what doesn't. And then we'll come up with a plan that actually suits you and your body type, because that's literally the most important thing, to have exercises that work for you, that you enjoy, that you can progress with safely. And so that's the video anyway. I hope it was helpful. If you got any thoughts or comments, let me know. And hope you enjoy the rest of your day.